It is now my pleasure to introduce Ricky Matthews, whose generosity has made it possible for us to bring Dr. Benjamin home.
Good morning. Those of us at NOLA.com and Times-Picayune are really thrilled and privileged to be a part of this special occasion this morning. As you know, Xavier has provided leadership for many years and vision that has helped make New Orleans one of the greatest cities in America. So today's announcement is really not a surprise in the sense that it is another in a long list of wonderful and important contributions that this university has made to this state. I want to say, too, that we're proud of our long association with Norman Francis and Xavier University. We've been strong contributors of Xavier for many, many years, and we're proud of that association. And we're especially proud that the NOLA.com Times-Picayune Endowed Chair for Public Health Sciences will be chaired by Dr. Regina Benjamin. I got to know her, got to know of her as a result of her incredible work in BioLabattery after Katrina. And then after the oil spill, our paths crossed. I've never met a more passionate person. Her work has led to her having a deep understanding of the health issues this nation faces. So I am confident that as she continues forward, representing not only this university, but this city and this state, that she will bring wonderful international attention to us and make a great difference. So Regina, we know this is a great day for Xavier. We know it's a great day for the city of New Orleans, but we mostly look forward to your leadership. So thank you for being a part of this. It's now my pleasure to introduce Raven Holmes, who is a senior here in the public health class of 2014. Raven?
By this point in my public health education, I can easily recite the definition of public health, name several professions that fall under its umbrella, and infer information from incidence rates and prevalence rates. I realize that choosing a career in public health means choosing to serve the people and to commit myself to a life of disease prevention and health promotion. But what does that mean? As someone who has had the opportunity to travel to various places in the world, I've seen firsthand the unnecessary struggles and challenges that are endured by so many. With all of the beauty that our world has to offer, there is no doubt that preventable disease and sickness still plague communities abroad as well as in our own backyard. To me, choosing a career in public health means advocating for populations who believe that they have lost their voice and working to secure the right for health equity for every individual. Xavier University of Louisiana's mission statement aligns with the ideas of serving our community and promoting a more just and humane society that resonate throughout the public health arena. The faculty in the public health department of the Public Health Sciences Department at our university have worked hard to encourage students to become involved in communities here and around the world. With the help and support of Xavier University's public health faculty, we were able to found GlobeMed at XULA. GlobeMed is a grassroots organization with 55 chapters at universities across the country, with energetic students that partner with organizations from Cameroon to India to Venezuela, working to promote global health equity. This university has an intelligent and motivated group of public health students who are willing and excited to take on challenges that lie ahead. I firmly believe that individuals with public health backgrounds are needed in every realm of professional society, from politics helping to write health policy to protect and educate the people, to physicians learning how to treat entire communities instead of individuals. As public health students at Xavier, we know that the journey to becoming the individuals that we were meant to be does not end when we leave the four walls of our classroom or when they hand us our degree. But when we continue to the next level of our education to become physicians, lawyers, epidemiologists, biostatisticians, and professors, we will never lose the foundation in public health instilled in us at Xavier. We know that our commitment to our world has to continue throughout our lives. We represent the faces that need to be seen and the strong voices that need to be heard in public health. We realize that our dedication to promoting health and preventing disease on a global level will pave the way for us to do great things. We will welcome the challenges that leaders before us have faced, and we are eager to look at them with fresh, knowledgeable eyes enriched by the education that we have received from dedicated professors. And now, even more than ever, we are inspired knowing that there is no limit to how far we can go. Maybe even all the way to the Surgeon General's office. We understand that we live in a world that is ever changing, and in order to meet new challenges, we must learn, adapt, and change ourselves. And we know that we're going to be ready. Because at the end of the day, I truly believe that overall wellness should not be a privilege given to those who can afford it, but rather a right that should be guaranteed for all. And now it is my distinct honor to welcome the 18th Surgeon General of the United States of America, Dr. Regina Benjamin.
Thank you, Raven. Wasn't she wonderful? I mean, Raven and her colleagues and the other students that are here from public health, can you stand up? Let us see you if you're around. Thank you. Most of them are in class right now, but they're the reason we're all here. So good morning. I want to tell you that I'm truly, truly honored to be named the NOLA.com Times-Picayune Endowed Chair in Public Health Sciences here at Xavier University of Louisiana. And I look forward to positioning Xavier as an international center for public health with a strong emphasis on community. When I came to Xavier a very long time ago, I had never seen a physician, a black physician, an African-American physician. And I had no idea I wanted to be a doctor. I didn't know what I wanted to do. I knew I wanted to go to college. So when I got here, this is why I'm a physician today. I like to join things, as most of you know. I'm a joiner, sororities and all the other things. But the most popular club on campus was pre-med. And of course I had to join, and I joined. And everything led from one thing to another. You know, we were competing about who would get accepted into medical school in their junior year, who would get the most acceptances. It's the culture, and that culture is here. And I'm sitting here looking right back at my professor, Sister Grace Mary, who stayed on top of us all the time. And I know Carmichael's around here somewhere, JW. You know, he doesn't like big crowds, but that's... But the foundation is so important, and that's why it's so important that we help build this foundation for our young students here, the public health students and all the students that are here. As I said when I was in the Rose Garden, when the president nominated me for Surgeon General, prevention is very important to me. My immediate family, my mother died of, they all died of preventable diseases. My mother died of lung cancer from smoking. She started when she was a teenager because she was a girl and she was a twin, and her twin brother could smoke, but they wouldn't let her because she was a girl, so she decided as soon as she was old enough, she would. So she died of lung cancer from smoking. My father died of complications of a stroke and hypertension, and my brother died of HIV. All preventable diseases, and I don't want other people and other families to have to suffer that loss. So I've been a longtime champion of the power of prevention, and it was the foundation of my work as Surgeon General. I had the privilege of chairing the National Prevention Council, which was established by the Affordable Care Act, and we released the first ever National Prevention Strategy, which is a roadmap to a healthy and fit nation. However, in July, I stepped down from my position, but not from my mission. This endowed chair at Xavier provides an ideal platform which I can broaden my mission of prevention and wellness. You know, when I was as Surgeon General, I was a 3-star admiral. Even though people called me general, I was an admiral. And I had 6,700 officers, United States Public Health Service officers under my command. We were one of the branches of the military, and just like the Air Force protect our skies, the Navy protects our shores, the Public Health Service protects our nation's health. So many people don't realize, and those were the officers that Karen was talking about that we sent to New Orleans to help. But I saw the dedication and the commitment that these young men and women were to serve their country. Times after Katrina, after Sandy Hook, the Boston Marathon shootings, when you hear of a CDC responding to an outbreak, it's oftentimes the United States Public Health Service officers because they can go on a dime. But I also saw that we need more. We need more of those professionals. And that's why I'm so excited to have this opportunity and to play a role in developing the future of public health professionals. You know, I realize that most surgeons general have often gone to medical schools or to academic health centers after they leave the position. But rarely, if ever, do they go to a small liberal arts college. And as Karen often says, and I add one more to it, health doesn't occur just in a doctor's office. It occurs where we live, where we learn, where we work, where we play, where we pray. It occurs in everything that we do. And so it's important that we get the community involved in their own health care. And I want to bring that health to the community and have the students engage in their careers early on. They get that foundation. Xavier has consistently ranked #1 in the nation in awarding bachelor's degrees to African American students in biology and chemistry, physics, and physical sciences. And the university, of course, is renowned for the number of African American students who go to and complete medical school. So we have a very solid foundation on which to build our public health sciences department. But sadly, in the United States, we rank low in the outcomes compared to other industrialized countries. And Louisiana and Mississippi, they were tied for number 49 out of 50 in the 2012 America's Health Rankings. We have some work to do. But Louisiana and the Gulf Coast provides this unique geographic setting with a concentrated mix of public health challenges, a large population of the medically underserved. Our obesity rates are above the national average. We have limited access to available health care, high rates of chronic diseases across all ages and all stages of life. I see this as a good thing. It offers an excellent opportunity for us to have this public health laboratory in which students and the faculty can receive their training, carry out their research, engage in the community, and affect public policy. Ultimately, this can have a global impact on what it takes to make a community more resilient. That is, to make it be prepared and to be able to bounce back after challenging times. We've done it. We're good at it, of bouncing back. We're good at being resilient. We can share that with the rest of the world. And so my role in an endowed chair is going to include some of the things that Dr. Francis mentioned. Reviewing a curriculum, particularly cementing the Xavier's position as an international thought leader and a center for public health. I'll work closely with Xavier School of Pharmacy, Arts and Sciences, the Center for Health and Health Disparities Research, and many of the other great departments that we have, and continue to develop our department of public health sciences. I'm going to teach classes. Hopefully we'll bring in some other, I wouldn't say well-known, but some other experts in the field of public health to expose the students and the faculty. Some of our local experts that are here, I hope will come.